Hi, my name's Elliot, and I have hemophilia B, and IDELVION gives me the freedom to do more of what I want to do. I live in Austin, Texas with my beautiful wife, and we have 2 kids. They're very active. I'm very active too, so it's important to me that I'm able to take care of my joints, take care of my body, and continue a healthy, active lifestyle. Over the years, I've found what works for me. I've been able to really enjoy cycling and swimming and kayaking. Recently, I've embraced yoga. It's been really beneficial for my joints. I was diagnosed with hemophilia B at 2 years old. I had bitten my tongue and it didn't stop bleeding. When I was a kid, they did not ship Factor to the house, so every time I had an accident or injury, I was having to go to the ER, and this must have been every 4 to 6 weeks. Then I'm either missing school or late for school, and it was a big burden on me and also my family. It was tough at times to explain hemophilia to others. I have some target joints of my right ankle, and I would go to school some days on crutches and the next day not, and my peers wouldn't understand that. I have an older brother. He does not have hemophilia B. Seeing him being able to participate in more competitive sports, football and basketball, honestly, it did take a mental toll. And there were times where I wondered, why me? Why am I different? I didn't know anyone else with hemophilia B, so being able to speak with others would have really helped me. I really started to gain independence around 8 or 9. Hemophilia camp was a really big bright spot for me. I was able to surround myself with others and learn from them how they manage their hemophilia B, and that's when I learned to self-infuse. I really had a sense of confidence after being able to successfully infuse. I remember transitioning from an on-demand treatment, only when I had a bleed, to a prophylactic treatment, treating preventatively. Prior to switching to IDELVION, I was infusing 3 times a week, and it was taking a lot of mental space trying to understand my factor levels. It was an arduous process to complete my infusion. I was constantly having to adjust my dose and also constantly experiencing bleeds. So when IDELVION became available, I brought it up to my physician. We talked about potential benefits and also potential side effects such as headaches and dizziness. It's a long-acting product, and that intrigued me. If I could cut down on the number of infusions but keep my factor level sustained, I would have the protection I need. Every Wednesday is my infusion day. After the kids go to bed, it takes me typically less than 10 minutes. That routine works really well for me. I've been able to infuse once per week while keeping my factor level stable. It's extremely important for me to know that my Factor IX levels are going to be sustained, even on the day or 2 before my infusion. After switching to IDELVION, I've been able to manage my hemophilia B much better and reduce the burden that hemophilia plays in my life, allowing me to spend more time with my family. I've been on IDELVION since 2016, and I'm no longer thinking about my hemophilia as much. Because I can measure my Factor IX level, I feel that I'm protected. If you're curious to learn more about IDELVION, you can talk to your doctor. My experience with IDELVION has allowed me to live a healthy, active lifestyle and keep my hemophilia at bay. I have the freedom to do the things I want to do, and I have confidence knowing that I have the coverage I need.
Important safety information. IDELVION, Coagulation Factor IX Recombinant Albumin Fusion Protein rFIX-FP is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. You might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.